This podcast is brought to you by North Carolina's electric cooperatives.
This is NC Spin, an unrehearsed discussion on issues of interest to North Carolinians. Now, here is your moderator, Tom Campbell.
Thank you for tuning in this week's NC Spin. We may have observed April Fool's Day this week, but few people were in a joking mood. As it has been in recent weeks, the number one topic on people's mind is the coronavirus. So we begin this week's show with excerpts from our weekly interview with DHHS Secretary Mandy Cohen. Then our panel will sound off on how this is impacting our lives, as well as our state budget, tax collections, and the 2020 elections. This week's panel includes Donna Martinez from WPTF Radio and the John Locke Foundation, John Hood, syndicated columnist and author, Chris Fitzsimon, director of State's Newsroom, and Anna Beavon Gravely, the executive director of NC Free. We'll begin our uninterrupted debate after these brief messages from our underwriters.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
Life's busy, but you're in control. As an electric cooperative member, you have access to lots of tools to help manage your home energy use and budget, so you can focus on what's most important.
Once again this week, we had the chance to interview DHHS Secretary Mandy Cohen on Wednesday, and we want to begin our show with excerpts from that interview. Let's roll the tape.
On Tuesday, you released some fascinating data late Tuesday afternoon. I want to ask you some questions about it. Of the deaths that have been reported so far, most of the deaths were from men, and most of them came from people that were over 65 years of age. Now, the other side of that data shows that the number of cases in the age groups, the number of cases that are reported, only 19% were people over 65. How do you coordinate those numbers?
Yeah, so it very much correlates to what we've been saying. Who is at high risk for severe reaction to this virus? It's people who are over the age of 65 and those with underlying medical conditions or a suppressed immune system. So if you look, unfortunately, at our deaths, you're going to see that be heavy in a population that is over 65 or who had chronic medical conditions.
So not as many older folks, and I fall in that category, are contracting the disease, but when they do, it is more serious.
That is right. And the reason why I think folks who are older are not contracting it, I think that they are recognizing their own risk. Very good job. Recognizing their own risk, staying at home and doing those things to protect themselves. I think some of the folks who are younger don't realize yet that they too play a huge role in this and helping us slow the spread.
But it was fascinating that 43% were between the ages of 25 and 49, and another 26% were between 50 and 64.
Yep.
This is not just an old folks disease.
Oh, it is not. So when we're talking about risk, it is risk of getting serious illness, but everyone is susceptible to this disease at any age, including children. We know that children can get COVID-19. We just know that they don't get serious reaction to it, which is good news as a parent of a 5 and an 8-year-old, happy to know that my kids won't get a serious reaction, but they still could catch it.
Part of your data that was fascinating showed that roughly 26% of all the cases come from Mecklenburg County, and half of the hospitalizations come from Mecklenburg County. Why there? Is it because of international flight travel or what?
Yes, I mean, those are our population centers. I don't think we're surprised to see more of our cases where there's more people and, of course, where there's an international airport and more mass transit. It's just where people are moving around and bumping into each other more. So we are definitely looking at our more populated areas. But what I would say to our folks in rural areas, yes, folks don't bump into each other quite as much because there's less folks, but that's where we also have less medical resources.
You said last week if you're living in one of these counties, and I think there's some 28 counties or 18 counties that don't have an instance of it, it's coming.
It's probably already here, is my message. It hasn't shown up in the numbers yet, but my sense is it's already in all 100 counties here in North Carolina. Obviously, we are trying to move to testing folks who are ill in our hospitals, our healthcare workers, and others. And so we know we're needing new techniques to understand how the virus is spreading around North Carolina. But I think what we have shown is that we know the virus is here before it even shows up in our numbers. And that's my advice to everyone, which is take this very serious.
Well, you were saying that 5 weeks ago.
And I don't want to say I told you so,
but you told us so.
But here we are, and we need to be staying at home and washing our hands.
This pandemic has had an impact on everybody's life. It's changed lives in our state and in our country and in the world, for that matter. But in addition to the obvious physical health issues, there are evidences of fear and depression and anger evidencing themselves. You alluded to that a few minutes ago. If I feel that I am having some emotional issues, what should I do?
Thank you for bringing this up, Tom, and it's so important. We're asking folks to do something that's very unnatural, stay isolated, and in a time of so much uncertainty and challenge. So we know that mental health is going to be strained for everybody. If you need help, please go to our website, dhhsnc.gov/coronavirus. There's a tab called Managing Your Health, and under there have some resources about how you can connect by phone to some behavioral health providers. They want to be there for help. Obviously, we always have our suicide hotline, but if you need...
So I could call a professional and get some help.
Absolutely, and we want you to do that. So please do take care of yourself. Make sure you're doing, good things like taking a walk, reaching out to friends by video conference or by phone, or then reaching out to some professionals that are out there who want help.
This business of checking in with friends and neighbors is something that I don't know that we've emphasized enough. How you doing today?
I think that common neighborly checking in with each other is incredibly important. We got to pull together as a community here. And then take care of yourself. Make sure your chronic diseases are under control. Control your sugars. If you're diabetic, get your blood pressure under control. Go out and take a walk. Eat right. And then stay home, wash your hands, and be patient with each other. Be kind out there.
We thank Dr. Cohen for taking time to visit with us. I hope you agree she's good at telling us where we stand and what's going on in our state level. And as she said, we should all send a virtual hug to her, Governor Cooper, the Emergency Operations Director Mike Sprayberry, his team, and all healthcare workers in our state for what they're doing. By the way, you can see that full interview by going to our website, ncspin.com. And you can click on the featured videos section, and it's there. Chris, let's talk some about the things that are going on right now. When we first started doing our interviews with her March 5th, hard to believe, we'd just come out of primary elections. We had 6 cases in North Carolina. As of this Friday morning when we taped, there are more than 2,000 cases. We've had 18 deaths. We've got this separation, stay home policy in North Carolina. It's been in effect since Monday. In the days since it started, how well is it working?
Well, it seems to be working well. I think the one of the things about a public health crisis I'm always interested in, I heard Dr. Fauci say this a couple of weeks ago, is the best case scenario is that fewer people die and then later people say, oh, we overreacted. If you think about it, instead of underreacted and more people die. And got sick. I do think we're doing better. I think that North Carolina is not as hard hit as some states. I was reading before we taped this morning, an interesting city as an example, San Francisco of all places, had a very early lockdown. They have far fewer cases and deaths than many cities their size. There really is scientific evidence. This isn't just somebody hoping that this works. There really is scientific evidence that the less we are in contact with each other, the better. One quick note, I was stunned this past week. Governor Kemp of Georgia finally issued a stay-at-home order and said he didn't realize until 24 hours before that people who don't have symptoms spread the virus. When he said that, he was 6 miles away from the CDC that had issued that statement in January. So sometimes our political leaders are way behind the curve.
You think you'll see that again on a re-election campaign?
I don't know, but it's not just politics. It's not just politics, though, Tom. This literally is life and death for some people.
John, you wrote a column this week in which you said that this sheltering concept, the stay-home concept, can't last indefinitely. Explain that.
Well, by definition, it can't last indefinitely. I was more specific than that. I think we can do it for weeks. I don't think we can do it for many months. And I think that some public officials have said not enough as far as the clarity of this. I don't mean the specifics. In fact, North Carolina's stay-at-home order is, as you look at it closely and how it's being applied, it's actually more flexible and I think more reasonable than in some parts of the country. But there has to be some clear indication from our leaders that they're working on a new plan. Because stay at home to June, stay at home to July, stay at home to August is preposterous. It'll never happen. We'll never be able to get through that. We all know this is true.
You think people just won't tolerate it?
Well, and it's just not, we cannot sustain the basic services and goods and the economy in that world.
Keep everything going.
So we're going to have a variety of different testing regimes and getting carefully but gradually getting people back to work and back to their lives.
Donna, we've had 300,000 people file for unemployment insurance since this whole thing started. So far as it goes, the law says that if you're unemployed, you can collect up to half of your pay with a total of $700 a week. So half of it's $350 a week. And that can be for a maximum of 12 weeks. There are a lot of people saying that we need to loosen these restrictions, both so far as how much you can receive and how long you can receive it. What do you think?
Well, I think the calculation that we still don't really know is how the federal benefits relate to the state benefits and really how much money people are going to end up receiving. There will be, no doubt, a lot of pressure on legislators to go ahead and extend this, whether it's extend the time period or increase the benefit temporarily. But here's what really concerns me. Like, for example, in your interview with Dr. Cohen, you're talking about the mental health issues. And to John's point about how long can we actually do this, this has not only changed people's lives, it's hurt people's lives. And if you want someone to be self-reliant and mentally stable and healthy, the number one thing you have to do is make sure that they have the opportunity to have a job, to be self-reliant, to bring in some money, to care for themselves and their family. And for me, that's the biggest concern long term. What are we doing to people? How is it going to manifest itself if we don't start opening things back up?
Annabelle, and there are people who are saying the legislature is due to convene April 28th. They're saying they need to come in a lot earlier than that because there are a number of issues they need to address, unemployment being one of them, perhaps some other personal individual grants or some other things that they could do to improve things in North Carolina. What do you think? Come early, April 28th?
I think they should come early. I think the more we can have a conversation, and John mentioned a little earlier about wanting to hear that there are solutions and wanting to hear that that our lawmakers and those who are in a position to be able to make an impact, to move things forward, are doing that, are doing just that. We're seeing a lot of conversation on the federal level and looking for additional clarity on that. And then we also want to see that from our state lawmakers.
And we know Governor Cooper and the legislative leadership are having conversations.
Yeah, absolutely.
I mean, they are acting, they're talking with each other. But
I think we want to see it more directly.
I hear you. Chris, there's some interesting things that have happened as a result of this. The crime rate has dropped precipitously, but conversely, gun sales are going out of the roof. How do you correlate those two?
Well, I think people are scared and worried, and when some people are scared or worried, they want more weapons to protect themselves. I think there are two things about the crime rate. Yes, people are staying home, they're not going out as much, and two, thankfully, police are less likely to arrest nonviolent people. If there's a judgment call, why would you take somebody to a crowded jail when we're in the middle of a pandemic? And I don't think that endangers public safety. They still should pay some penalty or be cited or whatever, but I think it's a combination of not as many people out there, and our policing is slightly different than it was 2 months ago or a month ago.
You bring up a good point, though.
Civil liberties questions to this,
yes,
to this whole issue as well. I mean, that's where you're starting to see people wonder, okay, I'm with you on this. I'm going to be prudent. I'm going to comply with the order. But I'm starting to see different officials start to say, I must do this or I can't do this. How far will this go and what precedent does it set?
I think that's some of what John was saying in his column, too. John, we've got 50,000 people incarcerated in local and state jails and prisons across North Carolina. There is evidence now that the coronavirus is beginning to be manifested in our prisons, and some people are saying we need to release some of these prisoners that we've got, particularly those who were not guilty of heinous crimes. What do you think about that?
It's understandable. There's probably a reasonable application of the idea to a class of offenders. I think we have to be very, very careful here. On the one hand, we've got people who are potentially at risk in the prison, in the jails. On the other hand, some people who are in prison for nonviolent crimes pled down from violent crimes. And let's not pretend that they're just all people who smoked a joint on the street corner. So we have to be very careful not to create a new public safety hazard as we address the current public safety hazard.
But I'd like to, I don't disagree with that, but there are significant numbers of people who are in prison because they didn't show up for a parole hearing, a probation hearing. There are people in prison who did smoke a joint on the corner. And so the key is some systematic way. If we get those people out, at least temporarily, there's more room for the people who are there and need to stay there.
Well, speaking of space, Atrium in Novant just yesterday said that they're going to be short about 3,000 hospital beds in Charlotte. They're even talking with UNC Charlotte about taking over some of the dorms there and using them for patient beds. What do you think of that idea?
Well, I think it's definitely a clever way to look at trying to provide, because when you think about a dorm is very similar to the way a hospital is set up. So I think that's a reasonable option for them.
Some students might tell you that they were in a hospital.
Yeah, they would. They probably would.
I love that idea. I wish we would take that ingenuity and apply it to the situation with North Carolina prisons. We have seen all of these different ideas, people really thinking out of the box about, we have cruise ships off the coast of Florida. What do you do with those people? And so now we're looking at facilities in a much different way and looking at the potential uses rather than letting people out. I mean, what does that say to the victims?
What do they say? Necessity is the mother of invention?
Exactly.
Yeah.
What about some innovative idea to maybe move prisoners, space them out? But you can't just do away with law and order and criminal justice, even though we're facing this public health issue. We can do better than that.
We saw another interesting concept this week, Chris. UNC announced that they are going to be changing, some say loosening, their requirements as far as admissions are concerned for this coming school year. They are now saying you don't have to have an SAT or ACT score, ACT score, as long as your GPA is 2.0 or better. But if you have a GPA 2.0 or 2.5 or better, and 1,000 on a combination of ACT and SAT, that's going to qualify you to get into a UNC school.
Well, and because all the rules are different, but they're not 100 kids this weekend all over North Carolina sitting together taking an ACT test or an SAT test in other places. This is just an example. Every single thing is going to be different for the next year because of what happened this spring, even if it's over, and I don't think it will be this spring. Everything you can imagine, from public schools to university admissions to every sort of normal thing, is for 1 year is going to be in some way suspended and changed.
And there will be some people, AB, who have been admitted to the school of their choice, who now, because of parental financial situations, their own financial situations, may not be able to afford it.
Yeah, I think it's going to be very difficult to make across the board decisions into the future when it comes to looking at the real impact of this, whether we're looking at businesses and the impact that it has on businesses or on students and their educational development. It's going to be very difficult to make those predictions.
And we want to say that's a long way away.
Totally.
But on the other hand, August is when colleges normally get started.
But March lasted forever. It's hard to believe that we just a month ago had Super Tuesday.
We've talked about the fact that we don't have an approved budget for this fiscal year, and we're operating off the budget that was authorized in 2018. How's that working out for us? How are tax collections being affected? The Department of Revenue recently closed because an employee contracted COVID-19. Let's discuss this. Donna, let's begin by talking about how state tax revenues are looking. Before COVID-19, our projections showed us running far ahead of how we had budgeted. How's it doing now?
Well, the prospect is pretty ugly. I mean, you've got all sorts of factors that are now coming together for roughly 3 to 4 months here in this current fiscal year. So you've got people aren't working. They've been told they can't go to work. less withholding going into state coffers. You've got businesses told they can't operate, less corporate income tax revenue. You've got people who aren't shopping, aren't buying the things they normally buy, except just the basics, the groceries, less sales tax coming in. People aren't driving. They've been told to stay in their homes, less gas tax. So that part of it is ugly. On the other hand, we are much better positioned than a whole lot of states, and that's because we have actually saved and we've been prudent in our spending over the last half dozen years or so. That is now really being focused on, and we can now see that the decisions made by those Republican leaders over the past few years were the correct decisions. So we've got roughly a $3 billion cushion. That doesn't mean we should be spending it all right now in this fiscal year, but if we need it, we do have a cushion.
John, the Department of Revenue filed and issued an order saying you don't have to file your taxes this year on April 15th. It's okay to wait until July 15th. And, by the way, if you owed anything as of April 15th, they're going to waive the penalties that might be associated with that, but they can't waive the interest by law. That's something the legislature has got to do. Is that something they should do?
They will do. There's no question they will waive interest as soon as they get back to Raleigh. That is a delay of tax revenue collected rather than necessarily a net loss in the long run, but it's still going to affect this year's budget potentially by billions of dollars.
And they're saying, by the way, that they are projecting that this quarter's revenues are going to be down by about $200 million. So it is impacting.
And it also, remember how the General Assembly always puts the budget together is they wait until they get the April 15 figures, which usually is sometime in May. And as we just discussed, they won't even get the revenue figures until July 15. So when you're thinking about next year's budget, obviously they won't have a lot of information.
And they may have to change the calendar.
Well, I was going to say
this come back later in the.
Well, so when they come back into session, AB says they ought to come back early. I agree with that. Are they going to try to pass again the budget that they passed in 2019, or are they just going to start from scratch all over again, John?
I think that the legislature and the governor, that they're talking about a budget. I certainly hope they are. My indications are there's been some conversation. They need to get something together for the end of the fiscal year, beginning of the next fiscal year, 2021, that begins July 1. But as I suggested, I suspect that more likely than ever before, there may need to be an adjustment to that budget as we get further into the next fiscal year.
Yeah, because, for instance, that budget had a $70-some million cut for DHHS for administrative costs, and I think in these circumstances there will
be a variety of changes. Yeah. As everybody's been saying, some of these changes are temporary, some of them might stick.
Well, one would hope that the governor is already talking with agency heads and saying, look, new world. Yeah. We have to look at everything differently, and you are not going to have the amount of revenue that we thought, and everybody should be sharing this pain.
We've got to shift to that. It's hard to believe, AB, but just a month ago, March 3rd, we voted in the Super Tuesday primary elections. Days afterward was when the news cycle was just overwhelmed with COVID-19. Yeah. Even so, the candidates are trying to get voters' attention. I feel sorry for them in many respects. You wrote a column recently, which we published on our website, in which you said that in this stay-home environment, campaign rallies and fundraisers are off the table. How are candidates communicating with each other?
I think they're having a very difficult time, truthfully. And it's one thing that's been really interesting for me to watch is it feels like everyone is relearning the internet. We're all learning how to FaceTime, how to Zoom. My grandmother is Zooming.
Your grandmother is
My
Zooming?
grandmother is Zooming.
It's
crazy.
I feel sorry.
But with all of this relearning that's happening, it opens up this new door for candidates to experiment with digital environments and communication forms that they've been hesitant to use before.
How do y'all feel about the fact I'm getting besieged by candidates on both sides, by the way, begging for money, and I'm thinking to myself, we're in a financial crisis here. How does it feel having them begging for money?
Yeah, AB was talking about the technology part of this, but the messaging part of this, I think some leaders are getting right. A lot of leaders and potential leaders, candidates, are getting very wrong. They're making this relentlessly, immediately way too partisan in their messaging, their fundraising pitch, their pitch to voters. That's not where voters are right now, and you need to be careful not to alienate them.
Where voters are, PPP released a poll last week, which was taken, I think, the 23rd and 24th of March. Now, granted, they are a more liberally oriented pollster. They said, in essence, The voters want Richard Burr to resign because of his financial issues. They're not real crazy about Tom Tillis, and they're giving Governor Cooper pretty high marks, not so much President Trump.
Well, I mean, Trump's record popularity overall is up a little bit, which happens. Usually it's up more in a crisis. I don't think there was anything shocking in that poll. The interesting thing about Senator Burr is it's not just liberal Democrats who want him to resign. He's been attacked from a lot of folks on the right wing or the right side of the political spectrum. He's asked for a Senate ethics investigation. The FBI is now investigating, which was a big development.
So much to talk about. Well, you've heard our spin on the issues. To stay informed all during the week, sign up for our free weekly email newsletter. Give your feedback and read my weekly column. Be sure to visit our website, ncspin.com, or catch NC Spin on Facebook. And while on the website, subscribe to our podcast and also our YouTube channel. And join us next week when we'll have more balanced debate for the Old North State. Until then, stay home, stay safe, stay informed, and watch out for the spin.
In more than 21 years on NC Spin, I never endorsed a product or sponsor, but I volunteered to do this message for family physicians. Over the past 40 years, my family doctor could quickly diagnose my illnesses because he knew my medical history. Evidence suggests I'll live longer, have a higher quality of life, and save 33% on health care costs. I believe in my trusted relationship with my family physician.
Family Physicians, your trusted healthcare advisor for life.
Life's busy, but you're in control. As an electric cooperative member, you have access to lots of tools to help manage your home energy use and budget, so you can focus on what's most important.
North Carolina Channel is made possible by the financial contributions of viewers like you who support the UNC TV network.